the Children's Community Health Center, we serve children ages 3 to 25 years old, and we have an array of services from very acute, intensive day treatment programs through programs that just help the child and the family with support around their community. Last year we had served over 1,000 children. The children that we see here in the Children's Community Health Center are the kids that you see in your everyday neighborhood. Those are the kids that, you know, are going to the schools in our community, that live down the street. And, you know, sometimes parents feel like they are not doing a good job in parenting, when indeed that is so far from the truth. Some of the issues that kids deal with these days are actually brain disorders, and there's no way that a parent could have prevented that. And so if a parent is feeling like, you know, this is my fault or I'm responsible for their behavior, yes, in a sense, parents are responsible for teaching their kids how to behave in a certain manner, but there are times that that's not possible because there are disorders involved, and those are things that we can help with, and that we can help determine if a brain disorder is involved, and help to treat either through therapy or medically, and so we don't want a parent's you know, pride or just feeling embarrassed. We don't want that to stop them from calling to make a referral. We really want to be able to see the kid and help the family system as a whole along. Some things that family members may see in a child may include a lot of crying or a difficult time in school. Sometimes kids have a hard time paying attention, and sometimes people notice their children really struggling with things like alcohol or drug abuse, or you know, if a child's been in a car accident or experienced a lot of trauma. Those are things that we can certainly help with. At any point, anybody can make a referral, whether that's a teacher, a friend, a parent, a doctor, and they can do that by calling our 1-800 number, which is 1-800-445-6262, and ask for the Children's Center, and our intake department, our customer contact center, will transfer them there, and we will triage. We will ask some questions and set up an appointment for an assessment, and then we will help determine if a child is in need of services. Anybody can be referred for services, no matter if they have insurance or if they don't have insurance. We take a variety of private insurances, such as, you know, Highmark and you can't see, but we also take children who don't have any insurance at all. So we again help to determine if the child, if we can help the child, or if we need to make another community referral. It is so important in a child and adolescent's life to receive early support and early intervention. The earlier we can help a child, while their brains and their emotions are still developing and their personalities are still developing, the more success that they're likely to have in life. So no matter if you feel that your child, if you're kind of questioning if your child needs services or needs some extra support, or you're not really sure, if you're on the fence, make the phone call, and we will help to determine if if it's something that we can help with. And sometimes we don't. Sometimes we say, okay, well, this is kind of okay, and we just help to give the parents some pointers. And parents can call and ask questions, even if they don't want to make a referral yet or don't want to have the assessment yet. They can just call us and say, hey, what does this sound like? More than likely, we're going to ask people to come in for an assessment so that we can just be certain, but we will always help to guide the parent through that entire process. Unfortunately, drug and alcohol use is on the incline with children and adolescents, and so a lot of times parents aren't really sure what to look for with those symptoms. Some of the things that may indicate that a child is using drugs or alcohol would include not wanting to go to school or skipping school, truancy, drop in grades, depression, anxiety, or just not acting the way that they may have acted in the past, even with socializing with family and friends. So again, and this is something that can be very hereditary as well. Drug and alcohol abuse is not necessarily a thing that a bad kid does. It's a disease, and we treat it as a disease, and want to be able to, again, provide early intervention with drug and alcohol treatment for children, adolescents, and their families as well.